Hi, friends. My name is Gina, and I've been taking Mounjaro for 13 weeks now. I'm on the 5 milligram dose, is what I'm taking. I also am going to share with you some really important things to consider when you choose a doctor for Mounjaro or for Zepbound for that journey, for your healthy lifestyle journey. And if you need a doctor for anything else, there are some important things that I have learned that can help you pick a really good doctor to be your partner in your life and health. Um, to start with, on Mounjaro, when you're taking Mounjaro or Zepbound, I'm taking Mounjaro for my type 2 diabetes. And some people are taking Zepbound for weight loss, and you can take Mounjaro for weight loss too. Zepbound is the exact same thing. It has tirzepatide in it, just the same as Zepbound and Mounjaro are exactly the same medication, but under the Zepbound label, it helps with your insurance. If your insurance will cover you for weight loss, and Mounjaro will help if you have type 2 diabetes for your doctor to prescribe it and possibly get some help from your insurance. Not all insurances will cover Zepbound or Mounjaro, but some will. I know for me, when I first, my doctor, who I have had for over 30 years, my primary doctor, he told me, gosh, probably almost 2 years ago about Mounjaro, and said that in clinical studies, people with type 2 diabetes were losing like 50 pounds on it. And that if I would like him to prescribe it for me, he would. And I was excited about it. And he wrote it on a piece of paper, and I called my health insurance and they weren't covering it. And it was over $1,000 a month. And I just couldn't afford that. Then this year, my husband, I found out right the day before Thanksgiving that he had bladder cancer. And while we were planning his surgeries and dealing with that and knowing we were going to be hitting our out-of-pocket maximum for him, I asked someone, a nurse that's supposed to help you figure out and navigate paying for your doctor bills, to check to see if Mounjaro was covered now for me. And sure enough, my insurance changed its mind, and Mounjaro is covered for people with type 2 diabetes, and was very, very affordable for me. And so I've been on this Mounjaro journey with my primary care doctor, who I've known over 30 years, and he has been wonderful. One thing I learned is that not all doctors are easy to get a hold of. You need to choose a doctor that will hold your hand when you have a question, that'll be willing to be your partner for this healthy lifestyle, because there's a lot of misconceptions out there, and you need someone who knows what other medications you're taking, what all the different medical issues you have other than obesity that you're fighting against. Someone who knows those things about you, so that way when you ask a question, even a simple question, like I found out recently that one of my viewers can't have Tums, and Tums is over the counter. It has calcium in it, and it's really great for stomach aches. But that particular viewer has a hernia and is taking hernia medication and absolutely cannot have Tums. It would be a big problem for her. So sometimes something that's simple that you can get over the counter can be an issue for you. And you need a doctor who's willing to take the time with you to answer your questions. So if you ask them and say, hey, the Mounjaro is giving me stomach aches, it's making me throw up, I'm having some issues, that they're going to know how to help you, and that will be willing to be there for you. So some of the things that you would need to ask a doctor is, what's the best way for me to contact you? Do you want me to, do I call and just leave a message with someone who answers your phone. And will you get back to me if I just need a simple question asked? Do I need to make an appointment? Do you have a patient portal? Patient portals are awesome. My doctor has a patient portal. So that way, if I want to know how much protein should I be eating, I can just ask that in the patient portal. It take me 2 seconds to write that down. And then within a few days, and sometimes even the same day, I'll get a response back without having to make an extra appointment. Those are really important things to be able to ask your provider. If you're getting your Mounjaro or Zepbound through a teledoc, how often can you call them on the teledoc? These are important questions to ask. And when you're with that doctor, do you feel heard and cared for? And that goes with any kind of medical problem you may have. Okay. And I am saying this because this week, for those of you who have been following my channel, I do have, I go live every Monday, which I call Mounjaro Mondays. I go live every Monday. I share what my experience has been with weight loss or not, and any side effects that I've been having, and maybe some things that I've been taking or eating that have been helping me out on my journey. And I've been sharing it with you all. Well, I have a medical issue that came about recently. And for all my friends out there who are female and you're not of baby making age anymore, you still have to keep track of when you have your period so you know when your periods end forever. And once you have your very last period for 12 months that you have not had a period, once you hit that 12 month, you're in menopause. Yay! That's like really great. But here's the thing. If you ever bleed after 12 months of not bleeding, that's called menopausal bleeding, and you need to see your doctor because there's a possibility that that might be a first sign of cancer. For me, my last period was in December of 2022. And then I started taking Mounjaro on January 10th. And on January 25th, I started having some bleeding. And I thought maybe it was from stress because my husband had his second cancer surgery on January 3rd. And I was stressed about that because I love him dearly. And I thought it was stress. And I am so thankful that my mom is a retired nurse practitioner, because if I do have cancer, she saved my life, because I shared with her, hey, Mom, gosh darn it, I was under so much stress this month. After 13 months, I started bleeding again. Gosh darn it. And I thought I was going to be in menopause and done, but now I'm not. And my mom said, whoa, Gina, that might be more than just stress. You need to see your doctor. And so I did see my primary care physician, and he had me do a pelvic ultrasound. And I also had a pap smear done. And my pap smear was a little iffy. It had one line on it that was red, that it's not good, that could be a problem. And in my ultrasound, they saw polyps and a couple of fibroids, and my lining's a little too thick. So he told me I definitely need to see a gynecologist. Well, you know what? I've not seen a gynecologist since my second child was born 25 years ago. Hey, Jeff.
Did you need a new doctor?
Looks like Jeff wants to play doctor with me. Ooh.
That's not what I'm saying.
Hey, I'm sharing with people about how important it is to choose a really good doctor. And you know what? Jeff, when he needed his surgery, his first doctor was trying something that wasn't very invasive. and going in through his privates up into his bladder with a scope, and then they were going to just yank the cancer out and then pull it out, weren't they?
Like lasso it and burn it off and pull it out, something like that.
Something like that.
Think.
Yeah.
I'm not a doctor. I don't
Right. And his doctor wasn't able to get it out, so he had an unsuccessful surgery. But she was really awesome, and she said while she was doing the surgery, as soon as she finished it, there's another doctor who does robotic laparoscopic